Hi, my name is Shannon Ron, and the topic that I decided to base my project upon was Alzheimer's disease. The reason that I chose this particular disease was just because it was something that had always piqued my interest even before taking this class. I have never really quite understood why that is. I've never had anyone in my family that has been diagnosed with Alzheimer's, nor have I ever experienced it secondhand. So I was just really interesting to dive into this topic, and I am more than excited to share it with you. So for starters, Alzheimer's disease is the most common form of dementia, which is a neurodegenerative disease in the brain, and it can be defined as the decline in daily cognitive and cognitive processes in the brain that can affect thinking and independence in an older adult. So in order to figure out whether or not someone has Alzheimer's, you need to pick up on the signs and the symptoms. So some of the symptoms of Alzheimer's include mild cognitive impair. That's typically where it begins and starts to manifest. But as the cognitive impair begins to progress, it turns more into apathy, a lack of wanting to do things, lack of motivation, depression, irritability, sleep disturbances or insomnia, anxiety, and aggression. But all of these signs and symptoms tend to originate from the memory loss and cognitive decline that you experience from the dementia. So a lot of these signs will begin to start like that, and as the disease begins to progress and get more severe, you start to see more behavioral and psychotic symptoms appear. Some of these can be something as simple as hallucinations or delusions. So patients can begin to see, hear, or even smell things that may not be there. And then delusions, they are believing things that aren't quite true. So a lot of patients have stated that they don't trust their caregiver, they don't know who he is, they don't know who their husband or partner is. And so that can really start to manifest, and a lot of it comes down to they don't remember, and they become agitated and start to put the blame on other people. And so that's typically where psychosis begins to start and can only get worse from there. So it is really imperative that you begin to notice it as soon as possible. And then moving on, some of the signs and symptoms are caused by a handful of things, but Alzheimer's as a whole is caused by the amyloid plaques that form on the neurotransmitters in the brain. There is not quite an entire reasoning, there's not a specific reason as to why these plaques are built, because even some healthy brains develop plaques through aging. So it's not entirely understood as to why some people develop Alzheimer's from these plaques and some people do not. There are a handful of risk factors that can contribute to whether or not you will develop Alzheimer's, but other than that, they're still trying to figure out not only a cure, but also a cause. But some of the risk factors in Alzheimer's, so someone who tends to act on these behaviors or has a habit of all of these are more likely to develop Alzheimer's than the one who does not. So some of the risk factors are whether or not the person has a good diet. A healthy and balanced diet is one of the best ways to prevent getting Alzheimer's, as well as regular exercise, whether it just be going on a walk or whether you're into running. There are tons of different exercises that can really impact the way that you age, especially if you're focusing on your body. Whether or not someone is an active drinker, an active smoker, use of alcohol or tobacco or nicotine really can affect the brain and promote Alzheimer's later in the future. Those who have Alzheimer's in their genes, they're also more likely to develop that. And so those who have a healthy diet, who have a regular exercise routine, do not drink or do not smoke, they are actually 60% more or less likely to develop Alzheimer's in their future. So it is just really important to focus on those, especially as college students or anyone who is not quite in that age range, to start focusing on that now, because it can really impact your future. The biggest risk factor, however, for Alzheimer's is age. So anyone over the age of 65 is at risk for developing Alzheimer's. There have not been any reports of anyone younger developing Alzheimer's, especially anyone in young adulthood. So again, just focusing on what you can do now to prevent it in the future is really important. A lot of the symptoms and causes really just depend on how this disease affects the brain. So when Alzheimer's enters the brain, like I mentioned, it is a degenerative brain disorder, so it destroys not only nerve cells, but also neural connections in the cerebral cortex. And so in this destruction, they also build up plaques onto your neurofibrillary tangles, and this can prevent a lot of connections that the brain is trying to make with these neurotransmitters, which ultimately leads into memory loss. This disease is very unpredictable, and so every case that you see will look a little bit different. So like I said, there are some healthy brains that develop these plaques versus some Alzheimer's brains who have these. And so it can be very difficult, and other regions of the brain can begin to be affected as well as time starts to go on, especially the part of your brain that deals with task-related activities, whether it be preparing meals or walking. A lot of people can be affected by their physical health through this as well. Another way that the brain can be impacted upon the recognition of this disease is that your brain can begin to swell. So neuroinflammation is very common. It's my cat, sorry about that. And this neuroinflammation can lead to cellular dysfunction and cellular death, which can be really dangerous, especially in a brain where cells are very important. And these cells in your brain can respond very similarly to a very wide array of stimuli. And so some astrocytes in your brain, once they're aggravated, it can promote neurotoxicity and can only spread the disease more, which can again be pretty dangerous. And not all researchers can even see the ultimate amount of effects that it has on the brain. So it's just very unpredictable, like I mentioned, and that can be dangerous in the long run. Another way that Alzheimer's can affect the brain is through white matter density. And so they found that white matter is ultimately and commonly disrupted, although there are some Alzheimer's brains who they have not noticed any change in their white matter density. So again, it can look very different between case to case. One of the studies that I read into found that density can also impact daily living, so especially in women. And so some of these examples could be cleaning, shopping, cooking or preparing food. And these are already affected by old age, so adding that on top of old age can really be a burden on not only the individual, but on the family as well. And so that's a little bit about how it affects the brain. Of course, there are more, but researchers are still trying to dig deeper into it. Now we're going to move on to diagnosis and treatment. So diagnosis is very tricky, and so is treatment, especially when treatment is not started immediately. Diagnosis is, again, very tricky and better if it's caught earlier on. But it is, again, hard to figure out, especially without that lack of research, or with that lack of research. The typical way that doctors tend to diagnose Alzheimer's is through the signs and the symptoms, but that can be very tricky because some symptoms don't show up until maybe 3 years after Alzheimer's has already impacted the brain. And so that method of diagnoses is not the most accurate and actually can be pretty expensive. And so some researchers have found using biomarkers in the brain and detecting whether or not there's Alzheimer's on those biomarkers is actually the most effective and the most inexpensive way to detect it, but it is still a work in progress, so it is pretty difficult to use that as a diagnostic treatment. And then as for treatments, there are only 2 medications for Alzheimer's that are FDA approved, and both of these have very adverse side effects, so it's a very big risk when it comes to choosing to take these medications. So one of the medications is a cholinesterase inhibitor, which really just inhibits that one specific cell to be running rampant in the brain. And then the other is an N-methyl D-aspartate. It was a receptor mediator, so it just, again, really mediates the receptors in the brain to kind of prevent that from speeding up the process. Both of these work best when it comes to early onset Alzheimer's, so when you catch it early on, it really starts to help and benefit the patient sooner rather than later. But the cholinesterase inhibitor works with severe Alzheimer's as well. There is a specific drug actually that works best. It's called donepezil. I'm not quite sure if I pronounced that right. I am not a pharmacist, unfortunately. But there were about 32 adverse side effects from this drug, ranging anywhere from diarrhea to nausea, all the way up until anorexia, just from having that loss of appetite and then wanting to pursue that after the appetite comes back. So that can be very dangerous, especially in older people who need the nutrients to survive and to remain healthy again. This drug did, however, see 20 to 30% increase in cognitive, behavioral, and functional symptoms. So it is worth the risk, especially if it is into the later, more severe cases. But it is very expensive to treat. It is very hard to treat, especially with a lack of research. And so it can get pretty tricky. Thankfully, President Obama back in 2012 started up a national plan which helped financially support the doctors who are trying to find treatments for Alzheimer's. And so doctors have been able to really look at autopsies and look at brains of those who have recently passed from Alzheimer's, which has really helped try and find this specific medicine for treatment, which can really be helpful in the long run. But ultimately, Alzheimer's is a very tricky disease. It does not have a lot of research, and it can be really scary, not only to the individual, but to the family who is witnessing their loved one go through all of this memory loss, psychosis, and whatever else may come along with Alzheimer's. But because of medication and diagnostics, now 100 years after discovering the disease, we are really making progress, and so we can really start to see more change with how they handle this disease later on in the future, hopefully, whether it be slowing down the progression of symptoms or even finding a cure, which they do not have just yet. So just again to remind you some of the ways that you can cut back and ultimately benefit yourself from developing Alzheimer's at a later age. Healthy diet, a regular exercise routine, cutting back on smoking and cutting back on drinking. Those really impact your later life. You are actually 40% chance less of developing the disease if you were to do these things. And so definitely keep that in mind. I really look forward to hearing from the rest of you and seeing how your research has impacted the way you view these diseases, as well as what other information I can gain from you guys. So thank you for listening, and I hope to hear from you all soon.